Welcome to the clinic at Pain Consultants of East Tennessee. The clinic is the heart of our practice. It is where the physicians, nurse practitioners, and LPNs work together to coordinate your care and develop an individualized treatment plan to meet your specific needs. Are you a new patient to Pain Consultants of East Tennessee? If so, let's walk through our new evaluation process so you will know what to expect. We want you to feel that your visit has been successful. Completing your medical paperwork is essential in informing us of the reason for your visit today. Please take the time to fully complete all paperwork and return it to one of the front desk attendants. It is essential that we perform a comprehensive physical examination during your first visit to our office. Once called back, you will be greeted by an LPN who will help determine your weight and escort you to a patient exam room. Once you go back to your examination room, an LPN will check your vital signs, your pulse, blood pressure, and respirations. The LPN will then ask you to change into a gown before the nurse practitioner sees you. Many of you might wonder why we ask that patients wear a gown during the initial visit. We need you to change into a gown so that we can perform a comprehensive musculoskeletal and neurological examination to determine what is causing your pain, what we often refer to as your pain generator. At this point, your nurse practitioner will ask you to describe your pain. We will ask questions so that we can determine the cause and location of your pain. We will have already reviewed the records from your referring provider and will carefully consider that information during this part of your visit. But your description of your pain is most important to us at this part of your evaluation. After we talk about your pain, the nurse practitioner will then perform a comprehensive physical examination, which may be more detailed in the areas that you indicate are painful. Your nurse practitioner will coordinate with other staff members, including your LPN, to document your medical information. Your nurse practitioner will sit down with you and explain what we need to do and why. We will also take the time to answer any questions you have, so please feel free to ask questions or discuss your concerns with us. Following your evaluation, you will be taken to the checkout area where we will work together to set up your follow-up visits. The initial visit is not about treatment. It is intended to gather important information about your pain. Are you a returning patient, and is this your first visit after your initial evaluation? If so, let's take a look at what you can expect today. When you arrive for your follow-up visit after your initial evaluation, you will be seen by a nurse practitioner and a physician. The nurse practitioner will likely clarify your pain complaints at the start of your visit. We may ask you to update us on any particular treatments that have already been started, like procedure response, or how you're doing in physical therapy or occupational therapy. The nurse practitioner will then step out of the examination room to review your complaints, physical examination, studies, records, and treatment responses with your physician before you meet them. Your physician will then come into the examination room and sit down to discuss your pain with you and further develop your treatment plan. The nurse practitioner will also attend with your physician to document your doctor's orders, help with clarification if required, and assist with your transition in our practice. Once your visit is over, you will return to the lobby area while any orders, record requests, or prescriptions are prepared for you. This provides our staff with one last chance to review the treatment plan directed by your attending physician for completeness. You will then be taken to the checkout area where you will set the date for your next appointment. At this point, your follow-up appointments will be scheduled, and we will ensure we have a current medical records release so that we can communicate with your other treating providers. Thank you for visiting the clinic. Our goal is to provide you with a comprehensive treatment plan that is both personal and comfortable for you. We look forward to working with you in the future.